Hi everyone, welcome to our class. I'm Denise Pattison and I am going to be guiding you through modern organizations in healthcare. I am a new Aspen teacher. I have previously taught at other schools and just came on board, and I'm very, very excited to be with you guys. So a little bit about myself. I am a nurse practitioner. I graduated with my undergraduate degree at the University of Cincinnati, and then I worked in critical care and hospice, and then I went to Georgetown University in DC for my Master's of Science, and I earned the FNP track, and I became board certified 3 years ago, and I've been practicing ever since in public health in Cincinnati. I focus on role development, primary care with my patients. I run a refugee initial assessment, transitional care into primary care. And I'm really focused on kind of looking outside the box on how to provide health care. I'm also in the midst of earning my Doctor of Nursing Practice at the University of Cincinnati. And I added a secondary postmaster's degree in education. I've been teaching for 3 years. I've taught many different levels. I've even taught non-nursing classes. So I'm really excited to be part of Aspen. It's really cool learning setup, really great mission, and I just love all the faculty here so far. So I'm really excited to be teaching with you. So a little bit about my background in organization systems. So I started as just a bedside, not just, but a bedside nurse, and kind of wanted to start getting involved right away. I'm sure, as many of you can attest in the RN field, when you first start, you're kind of the rose-colored glasses are taken off, and you realize that healthcare is a very complex structure, and it has even changed more and more in the last few years. And so we are now just learning how to better manage healthcare systems. And it's not just this straight organizational line that it used to be. It's quite complex, especially with the increase of technology and informatics in our healthcare system. So learning how that works in order to influence policy and procedure, to influence laws being made, and perhaps some of you want to move into management with your job, which is in very needed area. You will always have a job, and you can help exact change in this area. So when I first started working as an RN, I kind of was like, man, I want to make changes. How do we make that happen? And there's this huge hierarchy that is so daunting. And how do you become a leader? How do you learn to become somebody who can make changes? And for many of you in your undergraduate, you learned those things with your leadership classes and your quality improvement classes. And so part of that is modeling and becoming a change agent. So right away joining committees and learning how an organization works in order to find where you can fit in order to make change. So in the ICUs, I was on the magnet committee, and we helped the University of California, San Diego Medical Center get their magnet, and it was probably one of the more prouder days of my career. Working in hospice, I led a team in palliative medicine and participated on the ethics board. So finding ways to become a leader. I didn't have a leadership position. I just jumped into leadership roles within my scope. And now working at the Cincinnati Health Department, I'm one of the only nurse practitioners in a leadership position. And it just all started with just taking initiative and also understanding how our healthcare organization works. So that's kind of my spiel on how you can grow in your career. And it's not going to be this right away formalized managerial position for some of you. You're actually going to see growth in your career in different ways other than just taking a managerial track. So I'm really excited about this course. I would like to go over just kind of the objectives with you and the syllabus and how I like to roll as a teacher.